What causes diverticulitis flare-ups and how do I stop them? Imagine your colon as a long, flexible tube that helps move waste out of your body. Sometimes tiny pouches called diverticula form in the wall of the colon. When these pouches become inflamed or infected, it's called diverticulitis. But what triggers these flare-ups, and how can you prevent them from happening again? Let's explore the facts. Diverticulitis flare-ups are often caused by a mix of factors related to your lifestyle, age, and genetics. One common cause is when a diverticulum gets blocked by a piece of stool. This blockage can lead to bacterial overgrowth, which causes inflammation and sometimes infection. A low-fiber diet is a major contributor because it results in harder stools and increased pressure inside the colon. Over time, this pressure can promote the formation of diverticula and make flare-ups more likely. As you age, especially after 50, your colon wall naturally weakens, increasing the risk of diverticulitis. Being overweight or leading a sedentary lifestyle also raises the chance of developing these flare-ups. Smoking and heavy alcohol consumption are linked to higher risks because they can impair colon health and immune response. Certain medications, like non-steroidal anti-inflammatory drugs, steroids, and opioids, may also increase the risk by affecting the colon's lining or immune system. Genetics can play a role too. If you have a family history of diverticulitis or connective tissue disorders, your risk might be higher. Other factors under study include diets high in red meat, low vitamin D levels, and changes in gut bacteria. Interestingly, eating nuts, seeds, or popcorn does not increase the risk, contrary to some myths. So, how can you reduce the chances of flare-ups? The key is to adopt healthy habits. Increasing your fiber intake gradually by eating more fruits, vegetables, whole grains, and legumes helps keep stools soft and reduces colon pressure. Drinking plenty of water supports fiber's effectiveness. Regular exercise helps maintain a healthy weight and promotes good digestion. Losing excess weight can lower your risk of future episodes. Avoid smoking and limit alcohol intake, as both can harm your colon. Be cautious with medications like non-steroidal anti-inflammatory drugs and discuss alternatives with your healthcare provider if you have a history of diverticulitis. Managing other health conditions such as diabetes and chronic inflammation also contributes to lowering your risk. For those with a history of diverticulitis, ongoing monitoring is essential. About 22% of people experience a recurrence within 10 years, especially if they've had multiple episodes. It's important to follow your doctor's advice, including any dietary changes or medications prescribed. Recognizing early symptoms like lower left abdominal pain, fever, nausea, or changes in bowel habits allows for prompt medical attention, which can prevent complications. Regular checkups with your healthcare provider help track your condition and adjust your prevention plan. Because individual risk factors vary, working with your medical team to develop a personalized approach is best. While research continues into the roles of genetics and gut bacteria, no specific probiotic or supplement has been proven to prevent flare-ups reliably. Remember, there are no miracle cures or alternative therapies supported by scientific evidence that can replace proven medical treatments. Always seek professional advice if you experience symptoms. Maintaining a high-fiber diet, staying active, avoiding smoking and excessive alcohol, and keeping up with medical follow-up are your best tools for long-term health and relapse prevention. Every person's situation is different, so consult your healthcare provider to tailor strategies that suit your needs.